Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the three layers of the tissue. So first we'll talk about the pericardium. So the pericardium is a triple layered fluid filled sac that surrounds the heart. The outer layer of the sac is the fibrous pericardium, which is the strongest layer of the connective tissue. It adheres to the diaphragm inferiorly and superiorly it is fused to the roots of the great vessels that leaves and enters the heart. So this figure represents the various layers present in the heart. So there are three layers present in the heart. The outermost is the pericardium, innermost is the myocardium, and middle is the myocardium, and the innermost is the endocardium. And the pericardium consists of three layers. First is fibrous pericardium, second is parietal layer of serous pericardium, and third is the epicardium, which is the visceral layer of serous pericardium. So in between serous pericardium and the parietal layer of serous pericardium present a cavity which is known as pericardial cavity. So the fibrous pericardium act as a tough outer coat that holds the heart in the place and keep it from overfilling with blood. Deep to the fibrous pericardium is the double layered serous pericardium. The serous pericardium is a closed sac sandwiched between the fibrous pericardium and the heart. And the outermost layer is the parietal layer of the serous pericardium and adheres to the inner surface of the fibrous pericardium. The parietal layer is continuous with the visceral layer of the serous pericardium, which lies on the heart and is considered a part of the heart wall. So this figure also represents the layers of the heart. So innermost is the endocardium, middle is the myocardium, and the pericardium is consist of three wall: fibrous layer, parietal pericardium, and the visceral pericardium. And in between parietal and visceral pericardium there is a cavity which is known as pericardial cavity. So the next layer of the heart is the myocardium, which is the middle layer of the heart. So myocardium is the basic muscles that makes up the heart. This muscle is involuntary and the cardiac muscle structure consists of basic units of cardiac muscle cells known as myocytes. And the coordinated contraction of the cardiac muscle is what makes the heart propel blood to the various parts of the body. And it is a function of the coronary arteries to supply the blood and oxygen to the cardiac muscles. This is the thickest of all the layers of the heart, and the cardiac muscles cannot afford to rest even for a single second. So it is absolutely essential that these muscles get blood supply and nutrition continuously, as any kind of disruption in the blood and nutrition supply to this muscle can result in death of a part of the cardiac muscles, which is known as heart attack or myocardial infarction. This could in turn leads to complete cessation of the functioning of the heart muscles, which is known as cardiac arrest. Thank you.